have known as Covid-19 is an illness caused by a new virus that can spread from person to person. The symptoms can range from mild to severe illness. There is no vaccination or cure yet. Since 31 December 2019 and as of 4 October 2020, 34,986,502 cases of COVID-19, in accordance with the applied case definition and testing strategy in the affected countries, have been reported, including 1,034,240 days. 9 months into the coronavirus pandemic, the official global death toll has now exceeded 1 million people. But researchers warn that this figure probably vastly underestimates that the actual number of people who have died from COVID-19. In a worst-case scenario, one group of modelers suggests that the number of deaths could exceed 3 million people by January. Let's find out about the disease, how it spreads, who is at risk, and what to do if you have it.
How it spread? The virus can spread from person to person through close contact with an infected person, including in the 48 hours before then has symptoms. Contact with droplet from an infected person, cough or sneeze. Touching objects or surface like doorknob or tables that have droplet from an infected person, and then touching your mouth or face. And who is most at risk? The virus that causes COVID-19 infects people of all age. However, evidence today suggests that two groups of people are at a higher risk of getting severe COVID-19 disease. These are older people, that is people over 60 years old, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The risk of severe disease gradually increase with age start from around 40 years. It's important that adults in this age range protect themselves and in turn protect others that may be more vulnerable.
Protect yourself and others from COVID-19. As we know, there is currently no vaccine to protect against COVID-19. The best way to protect yourself is avoid being exposed to the virus that causes COVID-19. You must stay home as much as possible and avoid close contact with others. You must wear masks that cover your nose and mouth in public setting. You may clean and disinfect frequently touched surface. You should wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer containing at least 60% alcohol. Practice social distancing. Buy grocery and medicine. Go to the doctor. And complete banking activity online when possible. If you must go in person, stay at least 6 feet away from others and disinfect items you must touch. Get delivery and take out and limit in-person contact as much as possible.
Prevent the spread of COVID-19 if you are sick.
Stay at home if you are sick, except to get medical care. Avoid public transportation, ride sharing or taxi. Separate yourself from other people and pets in your homes. There is no specific treatment of COVID-19, but you can seek medical care to help relieve your symptoms. If you are sick and think you have symptoms of COVID-19, seek medical advice and get tested. And after testing, if you get tested for the virus or you have symptoms, you need to stay at home. You will need to do this until you either have a negative test result or your symptoms have gone, whichever is longer. It may take a day or two for your test result to come back. If your doctor says you are well enough to go home, while you wait for your test result, you should protect yourself and others. If you meet certain criteria, you may be considered a suspect case and be required to isolate. People who are required to quarantine will need to continue to do so regardless of a negative test result. For further information, read guidance for people test for COVID-19.
Easy way to prevention yourself from COVID-19. Wash your hands.
Wear a face mask.
Temperature check.
Keep your distance.